When hepatic enzymes are induced, drug metabolism can increase up to 2 to 4 times. And that single change can turn the effective dose into a therapeutic failure. So when microsomal enzymes are induced, drug metabolism increases. And this changes the intensity, duration, and even the toxicity of the drugs. First, decreased drug effect. For drugs that are inactivated by the metabolism, induction leads to the reduced intensity and shorter duration of action. For example, failure of oral contraceptives. Increased drug effect, which is the opposite case. When a drug is activated by metabolism, induction can increase this effect and toxicity. For example, paracetamol. It forms a toxic metabolite. Enzyme induction increases this metabolite. Toxicity can occur even at lower doses. Now let's come to tolerance, which is autoinduction. Some drugs induced their own metabolism. That's called autoinduction. For example, there is carbamazepine and rifampicin. As a result, reduced drug effect over time. Now, the effect of endogenous substances. Now, induction doesn't affect only drugs. It is also increased metabolism of the steroids and bilirubin in the body. Now, the disease trigger, porphyria. Enzyme induction can precipitate and acute intermittent porphyria by increasing porphyrin synthesis. Dose adjustment problems. Intermittent use of inducers can disturb the dose adjustment of the other drugs. For example, oral anticoagulants, oral hypoglycemics, anti-epileptics, antihypertensives. So, we can say the research impact of this is it can even interfere with the chronic toxicity studies. Now, drugs affected by induction. There is a list of it, of course. Phenytoin, warfarin, tolbutamide, imipramine, oral contraceptives, chloramphenicol, doxycycline, theophylline, levodopa, and phenylbutazone. Now, let's come to the therapeutic use of this, the positive part. Enzyme induction can also be used clinically. For example, congenital non-hemolytic jaundice. Now, in this case, phenobarbital increases the bilirubin clearance. Now, in Cushing syndrome, phenytoin reduces manifestations. And in case of course, chronic poisoning and liver disease. And it increases the detoxification. So, enzyme induction is a double-edged sword. It can reduce drug action, increase toxicity, or even used therapeutically. That's all for the day, people. Thank you for listening.